This video is intended to support the training of all health personnel, doctors, nurses, midwives and birth attendants who assess the health of a newborn baby. A newborn infant should be closely observed to detect danger signs and abnormalities. Observation should begin immediately after birth. However, unless there are obvious signs of complications following the birth, mother and baby should be allowed to remain in close skin-to-skin contact and breastfeeding should be established. As soon as possible after that, a thorough surface examination of the newborn should be done. The purpose of this video is to provide guidance on how to carry out a standardized, stepwise, clinical surface examination to detect outwardly visible abnormalities, malformations, or major health problems that may require urgent attention. It identifies visible birth defects, outward signs of infection, or other visible signs that may harm or prevent healthy development of the newborn. Early detection of problems can help with prompt and effective management and can save lives. Of the estimated 130 million babies born each year worldwide, more than 1 million die within their first day of life. The first few hours of a baby's life are the most critical for survival. The images you will see in this video were filmed in a health facility in Ghana, West Africa. All the babies examined are healthy and show no external abnormalities. The babies and the conditions in your location may be different. However, just try to follow the examination procedures methodically, step by step, as they're shown. Try to develop a fixed routine that you use for every examination. Before starting, always remember, first and foremost, the safety and welfare of the baby is paramount. Ensure that mother and baby are both stable. Examine the baby in the presence of the mother. Ensure that the mother understands that you're doing the examination simply to confirm that the baby is healthy. Assemble all the necessary materials. The baby should be examined in a warm room that is well lit. The examination should be carried out with the baby on a comfortable, soft and easily cleanable surface. Wear appropriate clean clothing. Wash your hands with soap and water or disinfectant if available. Then dry and warm them before touching the child to reduce the risk of infection and discomfort. Keep the baby warm or covered as much as possible. Try to ensure that the baby is as calm as possible before starting your examination. A baby can be pacified by placing the baby's fingers in its mouth or swaddling and gently rocking it. Always attend immediately to any signs of distress the baby may display at any stage in the examination. Never leave the newborn unattended on a surface which is not completely enclosed. Systematically examine the baby from the head down, starting and finishing one part of the body before moving on to the next. Don't rush through the exam. It usually takes a few minutes, but always take all the time you need. Ensure that you have the necessary basic equipment readily available. Recording book or sheet or form, pen, weighing scales, tape measure, stethoscope if available. Before starting the examination, immediately look for danger signs that may require urgent attention. These include fast breathing, more than 60 breaths per minute, slow breathing, less than 30 breaths per minute. An accurate timed measurement of the breathing rate is only required if you consider the infant to be breathing abnormally fast or slow. Abnormally hot to the touch, fever, temperature over 38 degrees centigrade, or abnormally cold to the touch, temperature less than 35 degrees centigrade. An actual temperature measurement needs to be done if the child feels abnormally hot or cold. Severe drawing in of the chest during breathing, grunting or unusual sounds, convulsions, abnormal general floppiness or stiffness of all or any part of the baby's body, umbilicus draining pus or umbilical redness and swelling extending to the surrounding skin, more than 10 skin pustules or bullae, swelling or bruising, redness or hardness of skin, pallor, pale or blue color of skin or membranes around the mouth, movement only when the baby is stimulated or no movement even when the baby is stimulated, bleeding or signs of bleeding from any part of the body. If any of these outward signs are apparent, call for a doctor immediately or manage the situation according to recommended national guidelines and procedures. If there are no obvious problems, and once you are confident that the newborn is reasonably stable, you're ready to proceed. Firstly, check the identity. That is, the name, ID number, age and sex of the newborn is accurately and correctly noted in the record book. If you're not certain about the importance of an unusual finding, or if you cannot describe the problem but think it may be important, get the advice of a doctor or refer the newborn for assessment by a specialist. If in doubt, always record your observations. Remove all clothing from the baby. Gently lay the naked baby on its back on a warm, comfortable surface. Try to work systematically down from the head to the feet. First, look at the newborn. Does the baby appear to be too small or too big? Does any part of the body look too big or too small? Are there any parts of the body or face that look asymmetrical or abnormal? Record any observations you consider to be important and worthy of further examination. You should weigh the baby using a calibrated infant scale. The pan where the baby will be placed should be covered with a cloth, towel or blanket. Make sure that you set the scale to 0 with the blanket or cloth on it before placing the baby on the scale. This ensures your assessment of the baby's weight will be accurate. Record the weight of the naked baby in kilograms. Record up to 1 decimal place. Do not leave the baby unattended during this procedure. There are several instruments that can be used to measure the baby's length. A soft, flexible tape measure, which should preferably have both centimeters and millimeters marked, is commonly used. Whatever instrument you use, it is important to measure the length of the child from the top of the head down to the heel. To measure accurately, ensure that the baby is in an outstretched position. Usually, the baby's legs are slightly bent, so you will need to straighten them. This can be done by gently pulling the foot or flattening the knee like this, by gently pressing with the thumb or finger. The length of a baby often varies from one measurement to the next, and depends very much on the technique used. As long as the length is within the normal range for your country, there is no need to be concerned. The measurement should be rounded up to the nearest centimeter. Do not leave the baby unattended when recording the result of the measurement. Examine the color and texture of the skin all over the baby's body. Some skin discolorations are quite normal. For example, blue or dark marks on the lower back and buttocks, usually called Mongolian spots. These need not be recorded. Bruises and skin abrasions could be the result of the birthing process. Use your expertise and judgment to decide whether to record any such markings. Check for rashes, scars, skin tags, unusual red areas, swelling, hardness, large bullae, marks and unusual skin colour. Yellowish skin may indicate jaundice. Blue lips, mouth and tongue may indicate respiratory or cardiac problems that need to be managed urgently. Describe any significant rashes that you see in terms of whether they're flat, raised, red or pustular. Some rashes are common and usually resolve without treatment, but other rashes may indicate an infection that needs treatment. Again, use your judgment to decide if any rashes are unusual and therefore worthy of being recorded. Sometimes there may be open tissue on the head, abdomen and back. Cover this area with sterile tissues soaked with sterile saline solution before referring the newborn for special treatment if available. Make sure you record these findings. Hairiness at the base of the spine, such as you see here, is common with most babies, but may be more pronounced in darker-skinned newborns. It does not need to be recorded. The head circumference should be measured at the widest part of the head. Use a soft, flexible tape measure divided into millimeters and centimeters when taking this measurement. Make sure that you properly position the tape measure around the head like this to get an accurate reading. Make sure that the tape measure is above the ears and around the forehead. Measure the head circumference and record it in centimeters. The measurement should be rounded up to the nearest centimeter. Look at the shape of the head and at the shape and size of the skull. Sometimes the skull may look misshapen, like a cone, as a result of moulding during the labour process. This usually resolves spontaneously in a few days. Any unusual shape of the skull should be recorded. Sometimes there is a collection of fluid in the subcutaneous tissue of the skull, and this area will be soft when you apply gentle pressure to it. It usually resolves in 3 to 4 days. Another similar condition involves accumulation of blood under the membrane covering the skull bones. It does not cross the suture lines and therefore is not present in the midline of the head. It can look like 2 lumps or bumps on the head. This usually resolves in 4 to 5 weeks. If the head shape does seem abnormal, ask a doctor or nurse to evaluate the newborn and write your findings in the record. If the shape is fine, run your fingers over the scalp to ensure that the skull is reasonably smooth and firm between the sutures. The fontanelles are soft spots in the skull. There are 2 fontanelles, the anterior and the posterior. The anterior fontanelle begins just beyond the hairline of the forehead. The posterior fontanelle is just beyond the crown or vertex of the head. The anterior fontanelle is usually bigger than the posterior. There is often considerable variation in their size. If the anterior fontanelle is unusually large or small, this should be noted as an anomaly. Gently feel them by using your fingers. Both can usually be gently palpated. The anterior fontanelle can usually be seen to be pulsating. This is normal. Sometimes the fontanelle is either depressed or hollow or bulging out. In both cases, a doctor needs to be notified, as it may indicate a more serious problem that requires medical attention. Look at the face. Do the features look normal? Are there any unusual features, such as a small chin, narrow forehead, or abnormal positioning of the eyes? Record any such findings. There is often a reddening of the skin between the eyebrows. This usually resolves naturally and does not need to be recorded. To check that both nostrils are open, use a finger to gently close one nostril at a time to see if the baby is able to inhale through each nostril without difficulty. Examine the shape and size of the ears. Ears are quite variable in shape. Slight deviations in shape are common and normal. Look for abnormally small or missing ear parts and skin tags. Sometimes there is a small sinus at the front edge of the pinna of the ear. This is common, has no significance, and does not need to be recorded. If the baby is calm, it may open its eyes. If possible, observe whether there is a white or grey film over the lens, a cataract. Extremely rarely you may see notches, swelling, pus, or other unusual findings in the eyes. This should be recorded and notified to a doctor. Do not force the eyes open. It is better to wait for the infant to open its own eyes. If for any reason you are unable to examine the eyes, write this in the record. Examine the lips, mouth, and upper and lower gums. Check whether the mouth, tongue, and lips are pink. If there is a blue tinge to the lips and tongue, this is abnormal and should be noted and managed immediately. A band of tissue connects the tongue to the floor of the mouth. It varies in shape and thickness, but there is no need to interfere with it, and it does not need to be recorded. Sometimes 1 or 2 natal teeth can be seen. These should not be removed. Leave them alone, as they will fall out naturally in time. Check for a cleft lip. This is an abnormality where the lips are incompletely formed. A cleft palate can be more difficult to detect. During the first breastfeeding, check whether the newborn discharges milk through its nostrils during or after being fed. If you see this, then a more thorough examination should be arranged to check whether the palate is open. An unfed baby should not be allowed to go home. Gently lift the chin to observe whether there are any skin tags on the neck or whether there are any sinus tracts, holes on the side of the neck. Often there is a reddening of the skin at the back of the neck. This usually resolves on its own, does not need medical attention, and need not be recorded. Observe the chest. Is it symmetrical? Is it similar in shape and size on the right and left? Are there any extra nipples? Feel the pectoral muscles close to the outside of the nipples, just under the armpits. There should be firm muscle tissue there. Absence of this muscle tissue should be noted. Is the movement of the chest with each breath normal, or is it irregular or difficult? A baby having respiratory difficulty may also show signs of flaring of the nostrils and retraction of the area under the ribs. If so, seek help from a doctor immediately, but do not leave the baby unattended. You only need to make a visual examination of the abdomen. No palpation is necessary. Observe the overall shape. A bulging or distended abdomen should be recorded. It may suggest a bowel obstruction or intra-abdominal mass, which will need medical treatment. Observe and record any abnormal openings or other defects of the abdomen. Very rarely, internal organs of the abdomen may remain outside the body. If you see this, inform a doctor immediately, as immediate medical intervention is necessary. Sometimes there is a protrusion of the skin along the midline when the child cries. This is called the diastasis recti and has no medical significance. It disappears in childhood and does not need to be recorded. Umbilical hernia is a bulging out of the navel that is common in African babies. It usually resolves naturally within a few weeks. However, if it is large, it may need further treatment, so only record it if you consider it to be unusually large. Check whether the umbilicus is draining pus or blood, or if umbilical redness extends to the surrounding skin. If this is the case, record the details and seek immediate medical assistance. Gently clasp both legs and raise them to check the anus to see that it is correctly positioned and open. If the newborn has passed a stool, it is a sign that the anus is open and that the gastrointestinal system is functioning. In rare cases, there may be no anal opening. This is called an imperforate anus and needs immediate attention and surgical repair. Do not insert any instruments or finger to inspect the anus. Extend the legs to see if the length of the legs is the same and that the thighs and skin creases look symmetrical. Record this if it is not the case, as it may indicate problems with the hips. In male newborns, the urethral opening should be identified. If it is not situated at the tip of the glans but on the underside of the glans or shaft, it indicates a condition known as hypospadias. It should be recorded and may need further management. Observe the scrotum and palpate gently to confirm both testes have descended into the scrotal sac. Sometimes there is a collection of fluid in the scrotal sac. This is known as hydrocele and needs to be recorded, as it will require medical attention. In female newborns, check the outer and inner labia and the presence of a vaginal orifice. Check to see that the labia are not fused. Do not insert any instrument or finger to inspect the vaginal orifice. If possible, note also whether the child has passed urine, as this indicates whether the urethra is open or not. Observe the shape, length and symmetry of the legs and arms. Check whether there are any stiff joints. If there are, record the details. These problems tend to occur only on one side of the body. Observe if the legs are unusually bent or if either foot is positioned abnormally. If you turn one or both feet towards the midline and find it stiff and hard to do so, it is a feature of the club foot deformity. Record any unusual findings. You can observe the fingers by extending the newborn's curled fingers around your finger. Count the number of digits on each hand, whether the nails are present on each finger and thumb, and check whether the fingers are unusually short. You should see creases on the palms of the hands. These creases may be absent in premature babies. Sometimes there is only one line straight across the palm of the hand instead of two lighter ones. This is known as a transverse palmar crease and occurs in about 1% of newborns. It is usually harmless, but in rare cases it may be combined with other abnormalities and indicate a serious problem, and so should be recorded. Do the same with the toes. Count them. Place your thumb on the sole of the foot and the newborn will instinctively curl its toes over your thumb, making them easier to observe. Look for extra toes, missing or fused toes and missing toenails. Look to see whether there is any unusual webbing between the fingers or toes. This webbing is known as syndactyly. Check for skin creases on the soles of the feet. Record any unusual findings. Gently lift the baby up, supporting one hand under its chest and turn it over. Observe the back and spine by holding it gently but firmly with your hands supporting the abdomen and chest. Ensure that the baby is positioned safely to allow for observation. Run your finger along the spine like this. Note if the spine looks straight and whether there are any lumps or puffiness. Spina bifida is a severe malformation of the spine. It appears as a red, abnormally shaped spinal cord which bulges out of the back. It may also not be covered by skin. It occurs due to problems with formation of the bones of the spine. Inform a doctor immediately, as this defect requires urgent treatment. Record any unusual findings. Be sure that all your findings are clearly recorded in an antenatal record book or on an assessment sheet or form during or immediately after the examination. If you are not able to observe a particular part of the body, for example the eyes, indicate this clearly. Record if the baby has passed urine and stool. If the mother and baby leave the hospital within 6 hours of birth, counsel the mother to check if the baby passes urine or a stool within the first day. If this does not happen, ask the mother to bring the infant back for attention as soon as possible. Sign and date the examination record. It is a vital report of the health status of the newborn. When concluding your examination of the newborn, it is important to do the following. Wrap the baby again and hand it carefully to its mother. Reassure the mother clearly and positively that the baby is healthy. If you have found a problem, get confirmation or clarification from a doctor before telling the mother. If this is not possible, explain carefully and with consideration to the mother any problems or difficulties you have found and what action you are going to take. Report any abnormal, suspicious or unclear findings immediately to your superior. After completing the examination process, make sure that you wash your hands with soap or disinfectant. Be sure to also clean all the equipment you have used, such as the tape measure, weighing scales, stethoscope, bedding, etc. Dispose of all used materials in an appropriate manner. This is necessary to try and avoid any possible infection spreading to the next baby to be examined. This standardized, stepwise surface examination procedure will allow you to assess the basic physical health of any newborn baby. It will also help detect and record the appearance and frequency of birth defects, which will allow better policy to be devised, more appropriate allocation of resources, and more effective, customized training to be introduced. In carrying out this process routinely, you will be helping to improve the quality and efficiency of the health service you are able to provide, as well as being able to reassure a mother of the thing that she most wants to hear: that she has given birth to an outwardly healthy baby. Detailed information and further guidance can be found in Pregnancy, Childbirth, Postpartum and Newborn Care, a Guide for Essential Practice, produced by the World Health Organization, Department of Making Pregnancy Safer.